About 42% of Alabama's population live in a rural area. The gap in vaccination rates continues to widen between urban and rural areas. While approximately 75% of people in urban areas are vaccinated, vaccination rates in rural areas are only 58.5%. There are many possible explanations for this gap. Rural areas, especially those where there are few healthcare providers, may not have access to vaccines or as much reliable information. As a result, some in rural communities may question the importance of getting vaccinations. Advocating for herd immunity may be more difficult in communities that are more sparsely populated than in tightly packed urban areas. The importance of herd immunity may be questioned when a patient feels they have little interaction with others. Some may believe it will be more difficult to both become infected or infect someone else with a vaccine-preventable disease. Still, patients in rural communities are among the most vulnerable to these infections, especially if access to hospitals, clinics, and health care is limited. Here are some helpful tips when having these conversations with patients. When beginning a vaccine advantage conversation, it's important to remain non-judgmental. Keep your tone passive, respectful, and professional. Responses should always be evidence-based. Remember that your goal is to give the patient information and make suggestions based on medical knowledge. So it's important to not come off as argumentative or even appear that you're trying to push opinions on a patient. It's also important to gauge an individual's belief regarding vaccinations and their health literacy. Some people may be unwilling to get vaccines if they live in an isolated area and with no close neighbors and feel as though they pose no danger to the public. You might start this conversation by addressing the importance of the individual's health. For example, you could say, "I know you said you have high blood pressure and diabetes. These are known risk factors that increase disease severity. A vaccination would boost your body's natural defenses against disease to help keep you free of infection." It may be helpful to tailor the conversation specifically to the individual. Herd immunity is very important in reducing the spread of certain vaccine-preventable diseases. However, many people in rural areas feel as though this doesn't apply to them. While herd immunity might not appear to play a vital role in rural areas, it is still valuable in protecting vulnerable patients in both large and small communities. Many rural areas have limited access to healthcare facilities, and unfortunately, some, though not all, patients may have a low health literacy. As a result, people in these communities often suffer from comorbid conditions such as hypertension and diabetes that are uncontrolled or not optimally treated. Obesity is more common among adults living in rural counties. Over 34% of rural adults are obese compared to 28% of those in metro areas. When patients with these comorbid conditions become infected with a vaccine-preventable disease, their health status increases their risk for developing a more severe infection, longer hospital stays, and dying. This is especially true for more frequently circulating infections such as the coronavirus, influenza, or the bacteria that causes pneumonia. When having discussions in these rural populations, the main focus should be the individual's health. While many are aware of the effects diseases can have, they may feel as though they won't harm anyone else if they get sick. Ensure patients are aware that we are concerned for them and what benefits vaccines can have for them. Individualize these conversations based on patient-specific risks. Vaccinations play a vital role, not just in the United States, but globally. Let's take the example of the polio vaccine. Polio, an RNA virus, was once one of the most feared diseases in the U.S. in the early 20th century. Before the polio vaccine was available, outbreaks caused more than 15,000 cases of paralysis each year. Since the vaccine was made available, polio has become almost non-existent in areas with high vaccination rates. I have never known anyone who has suffered from polio, but my grandparents have. As we discussed before, those in rural communities may not think that they're at high risk of spreading diseases throughout the community, especially an infection that they have never known anyone to have. Unfortunately, we know the effects can be detrimental when preventable infections circulate in a community. This is true for infections that we are familiar with, like influenza and COVID-19, and true for other infections such as measles and polio. Not maintaining vaccination rates puts the entire community at risk for an infection that should, by all rights, be extinct. Recent outbreaks of measles and polio raised real fear for parents whose children were too young to have received the vaccine to prevent those viruses, and in families with loved ones with vulnerable immune systems. Vaccines were developed not just to prevent the infection themselves, but from the devastating consequences they can cause. In the case of polio, paralysis may not just rob a person's ability to walk, but also to eat, breathe, and participate in life. Other vaccine-preventable infections can cause long-term issues with the nervous system, muscle function, breathing and swallowing, fatigue, fertility, and many other complications. We have decades of experience in using vaccines and know that they are safe. What we still have not been able to accurately determine is which person will get a virus and recover easily and which will develop life-changing complications. You may not be discussing the polio vaccine with your patient, but you may be discussing the need for a vaccine to prevent the flu, COVID-19, or any other infections. Finding a vaccine that a patient does trust and then relating it to the vaccine that the patient needs is a great way to help them better appreciate the benefits that all vaccines have for themselves and for their communities. In speaking with individuals in rural communities, it's important to make guideline recommendations and give evidence-based responses regarding vaccinations. While you don't want to seem argumentative or demanding, it is important to stress the benefit of vaccinations not just to protect the community, but also the individual themselves. It's also important to convey the seriousness that diseases can have without using scare tactics. It's always vital that the individual feels as though it's their choice and that they have the autonomy regarding their health decisions. Together, we can help reduce the burden of vaccine-preventable diseases in our community. For more information, please visit the A Shot for Alabama webpage at ashotforalabama.com.